Hello friends, in the last class we have learned about the splenomegaly and also the causes of splenomegaly, the causes of massive splenomegaly. So this is the table showing the all the causes which we have discussed the last class. Now let us learn some important points about the splenomegaly. The splenomegaly, for identifying the degree of enlargement, ultrasonography is one of the investigations which is useful for identifying the degree of enlargement, whether it is mild splenomegaly or moderate splenomegaly or massive splenomegaly can be determined by using this ultrasonography. If the spleen is actually located in the left upper quadrant and it is located beneath the 9th, 10th and 11th ribs. It is somewhere here. It is located like now. Wherever there is splenic enlargement, two things can occur. One, it can extend inferiorly to the left iliac fossa. So, number one can extend inferiorly into the left iliac is number is, or number two, it can either extend into the right iliac fossa. That means at some point, so in the second part, can extend, can actually, first it can cross the midline, extends obliquely by crossing the midline, and then can lie as mass below the liver or inferior to the liver. First, the liver is here. It can either lie below the left lobe of liver, or it can even go, can cross the midline and go to a more extent, and it can even go to the right iliac fossa. Okay, if the size of the spleen is more than 18 centimeters, as we have already said, it can result in massive. The causes of massive splenomegaly are already been. So if we have to review it, the massive splenomegaly is caused by a hematological disorder like thalassemia major and infection like visceral leishmaniasis, hyperreactive malarial splenomegaly syndrome, mycobacterial avium intracellular complex can cause massive splenomegaly, and some of the infiltrative disorders like lymphoma, myeloproliferative neoplasm, and Gaucher's disease can cause massive splenomegaly. Now, on ultrasonography, we will have to see for one splenic architecture. The splenic architecture is the echogenicity of the spleen. This splenic architecture will differentiate between focal lesions, the focal lesions or diffuse lesions, because the spleen may be enlarged diffusely or it may be enlarged in only one particular area. So that can be differentiated in ultrasonography by studying the splenic architecture. Among these focal and diffuse enlargement of the spleen, diffuse enlargement of the spleen is the most common finding. Right. Now, if the spleen enlarges, so as spleen enlarges, that is, as spleen becomes bigger and bigger, if you see the echogenicity also increases. So as spleen enlarges, the spleen becomes more echogenic. Actually, this has no importance to a clinician. Because to a clinician, the cause of splenomegaly is important, but not the echogenicity of spleen or the background behind it is not important. But in experimental studies or in researchers or scientists, they try to quantify this echo texture. So they some researchers or scientists, they try to use this echogenic texture or echo texture characteristics of the spleen, and based on this echo texture characteristics of spleen, based on this they classified or they try to quantify the degree of fibrosis. Based on echo texture characteristics, the research tried to quantify the degree of fibrosis in liver and spleen. But still, this is not much useful because it has no clinical relevance. Because it has no clinical relevance, it's not much useful. So thus it is not much studied. But recently we have started using the elastography technique, and this elastography technique is mainly used in patients with or in patients who have risk of cirrhosis. And in these patients with risk of cirrhosis, with the help of elastography, we can identify the degree of liver fibrosis, and also we can identify the varices, whether the esophageal varices, about the esophageal varices or about the risk of the bleeding can be identified by using this elastography. Then how are you going to see the differential diagnosis? Based on clinical features and radiological investigation, both these will help us to find the cause of splenomegaly. Because as we have already seen in the last class, there are many causes of splenomegaly, and our main aim is to find what is the cause of splenomegaly so that the clinicians can treat the patient effectively. So, along with clinical features, even the radiological features, if we combine both, we can help to establish a good diagnosis. So, for example, if you see, if the patient has any liver disease from cirrhosis, or it can have the patient has any type of liver disease, cirrhosis, alcoholic liver, or any liver disease with portal vein collaterals. If you can see portal vein collaterals, one important portal vein collaterals is that it mainly occurs portal hypertension, and liver disease can also predispose the patient to portal hypertension. And one more important thing, this portal hypertension can also cause splenomegaly as already. So when we see a liver disease with portal venous collaterals in ultrasonography, then always we should suspect some portal hypertension to be a cause of splenomegaly. So if you see, this is the patient with portal hypertension. Here, these are the collaterals. This is the this is actually a color doctor picture. See, this is spleen. This echogenic structure, this is actually diaphragm. So this is spleen. What are these? These are actually the tortuous splenic vessels, or we can say tortuous varices, which are seen the spleen due to splenic vessels. See, these are the splenic veins, tortuous splenic vessels which are seen. So this is a case of portal hypertension, which shows portal venous varices are seen. So this is here portal hypertension, one of the cause for splenomegaly. Similarly, if you see that there are some focal lesions in any part of the body, along with multi-organ involvement, if there are many organs are involved, and if the patient has lymphadenopathy, so focal lesions with multi-organ involvement with lymph node enlargement lymphadenopathy, so always suspect that there is some lymphoma which is associated with it. So, if uh, clinical and radiological features can help to come to a differential diagnosis, but sometimes even if we do a lot of clinical and laboratory workup, even after that we could not find a proper diagnosis. That is, uh, these are the cases with isolated splenomegaly. In these cases with isolated splenomegaly, where even after considering the clinical features or diagnosis, if the differential diagnosis is not found, in such cases, we can do a splenic biopsy or splenectomy. But always weigh whether this is useful or not. Benefits versus risk ratio should always be assessed before you do the invasive procedure. Or in some patients, we can also do ultrasound guided splenic biopsy. This ultrasound guided splenic biopsy can be done mainly for focal lesions. What are the complications of splenomegaly? If the patient has splenomegaly, number one, because the spleen has been increased in size, so this can rupture, resulting in spontaneous splenic rupture. This spontaneous splenic rupture normally does not occur, but when there is enlarged spleen, there is splenomegaly, and along with splenomegaly, if the patient has either minor trauma, if the patient has even a small amount of trauma or minor trauma, or sometimes even cuffing, okay, or some of the insignificant events like cuffing, all these can result in spontaneous splenic rupture. One more complication due to splenomegaly is it can also result in hypersplenism. If you see on ultrasonography, you can see this splenomegaly, that is increased size of the spleen. This is actually a rib shadow. This is the aorta. This is the spleen. As the spleen size increases, you can also see that the echogenicity of the spleen also increases. So this is about some of the important points about splenomegaly.